Hello, and welcome to our webinar series on the 8 professional competencies for preventing drug misuse among college students. I'm Rich Lucy, Senior Prevention Program Manager in the Drug Enforcement Administration's Community Outreach and Prevention Support section. DEA is pleased to be part of this project to highlight the skills necessary for coordinating comprehensive campus efforts to prevent drug use. While we have made significant progress with these issues over recent decades, much more remains to be done. The foundation for this webinar series is a publication prepared by Dr. David Anderson, Professor Emeritus of Education and Human Development at George Mason University. The document was produced with funding from the Mid-America Prevention Technology Transfer Center, which is funded by the Substance Abuse and Mental Health Services Administration. DEA is pleased to continue its partnership and collaboration with SAMHSA and its Center for Substance Abuse Prevention. Over the course of these 8 webinars, we take a deeper dive into each of the core competencies that are designed to promote enhanced professional skills and ultimately affect college students' decisions surrounding drugs and alcohol, thus helping continue our progress. This third episode focuses on strategic planning, which is a critical component of any effort to prevent alcohol and drug misuse among college students. This webinar emphasizes, among other things, the entire prevention effort, including the campus and community context, vision setting, orchestrating a systematic process, and engaging key stakeholders. Furthermore, you will learn about the importance of effective relationships with key departments and offices, including an understanding and respect for their respective skills, roles and responsibilities, and ethical standards. Remember, prevention is not random. It must be intentional, it must be purposeful, and it must be strategic. It's our hope you and your campus benefit from the information being shared in this webinar. We think you'll find many ways to put the insights and contents to good use. With that, it's my pleasure to turn over today's episode to our host, Dr. David Anderson.
Thanks so much, Rich, for that kind introduction. And thank you and the leadership of the Drug Enforcement Administration for all your good work with drug misuse prevention overall, and for sponsoring this webinar series. As you highlighted, this work of drug and alcohol misuse prevention is vitally important. And it's one about which we as a nation have made great progress over recent decades. As you also noted, much more remains to be done. And that serves as the foundation for this new resource, the guide to the 8 professional competencies for higher education substance misuse prevention. And to prepare this, which was a year-long process, I engaged 5 experts with long-term and rich experience from around the country, from the West Coast to the East. And our aim with this resource is to help with a broad and grounded understanding of the knowledge, skills, and applications for this important work of campus prevention professionals and their colleagues. We call them the prevention specialists. So this work is for them. And all of this is included in this free downloadable guide. It's on your website and at www.preventioncompetencies.org. With this series on the 8 prevention competencies, these 5 experts provide their insights and their experiences. Today, we're focusing on the third of these competencies, strategic planning. Strategic planning. This visual illustrates what strategic planning is. 7 major competencies. And to help bring all of this to life is Dr. Karen Moses, who has worked at Arizona State University for over 30 years, a national expert, done a lot of strategic planning work. She serves as the Director of Wellness and Health Promotion. So with that background, Karen, I welcome you.
Thank you. I'm happy to be here.
So we're going to have a few questions. We'll have some conversation, a little bit back and forth. But a little bit of background, I think, would be helpful for our listeners and our viewers. Some background about yourself that links to strategic planning.
Sure. Thank you. I would be happy to give that background. So I've worked nearly 35 years providing health promotion and prevention leadership, as you mentioned, at Arizona State University, which, as I think our listeners will know, or viewers will know, is one of the largest universities in the United States. And I'm proud to be a part of the work at ASU. And one of the reasons anyway, that I'm proud is because our charter emphasizes inclusion and supporting the success of our diverse students, while also assuming fundamental responsibility for the economic, social, cultural, and overall health of the communities we serve. The charter sets the stage for strategic planning at the institution, and I feel fortunate to work under a charter that aligns with my values and with the aims of health promotion and prevention. It makes strategic planning a little easier to do because of these aspects of the work at ASU.
I find that fascinating. You mentioned the charter, and I find that so important with all of our work, going back to your charter, your mission statement, whether it's for the institution or for your division. So I really, really like that reference.
Absolutely. And, when the division includes the work that you're doing as a part of how they describe what's important, it is so satisfying to know that you are there, that you're not forgotten, that the work that you do is meaningful to the purposes of the university or whatever institution that you're working at.
So that's a great dovetail right into the next question about strategic planning and its importance. This is one of, in this guide, and this from our year of working together on it, this guide has 8 competencies areas, and this is one of them. So can you talk about why strategic planning itself is important? And then if you would, and you talk about it, link, and I know Rich talked about this in the introduction, link to the health enhancing environment. We talked about all 8 of these competencies, all 8 of these. And so today we're talking about the strategic planning one. Why is that important? And how does it fit in with these other 7 and the whole health enhancing environment?
Sure. Strategic planning is key to moving campus prevention efforts forward. The strategic plan connects prevention to the institutional plan, as I mentioned, having an institutional charter or mission that is at the sort of top of your strategic plan is critical. How do you fit within the institution, within the institution's plan? And then how do you fit within the web of plans across the institution that are all contributing to that, the overarching goals that are driving the institution, right? The most basic of the institution's goals are typically retention, persistence, graduation, something that gets at those concepts. Other goals might include that students have a productive life following graduation, maybe that they're civic minded, something around inclusion, contributing members of their communities, etc. So the strategic plan then that we work on articulates how prevention contributes to those institutional goals. It defines why we're doing prevention, what we're doing, with which partners, for which populations of students, in what context, and in what time frame. Through a logic model, for example, we can build in our strategic planning process, the logic model that we build in our strategic planning process, we're able then to visualize how each program contributes to the overall change process that we're developing for our campus. And we can see how our plans fit within the campus efforts for student success, diversity, equity, and inclusion, student involvement, research, and other key institutional goals. And I found that having a plan sets the stage for everything we do in prevention. This is one reason it's so important. It tells our administration what we're doing and how. It tells our staff what they're doing, with whom and why. It shows staff how their efforts contribute to the greater good. It serves as a guide when we're asked to lead initiatives outside of our plan. We can use the plan to discuss with our administration or our partners or our teams. If we start this big new effort that we've been asked to start, how will it impact the overall plan? What do we need to give up? What additional resources are we going to need? The strategic plan lays the groundwork for all other conversations about our work. And those conversations ultimately are about the health enhancing environment that we're building for our students, right? So I think of this health enhancing environment in context of the strategic plan, meaning that our strategic plan needs to be comprehensive. It serves as a map within a map. So the big map is the map of the web of plans across the university that are leading to the university goals. And then you have that call out in the map that zooms in on a particular community. That's the map of us. That's the map of prevention that tells all the roads and all the directions for what we're doing and where we're going within that larger plan for the campus. And ultimately, what's being done, it takes into consideration what's being done outside of prevention and within the context of prevention across that whole map. And then, determines how we're going to get things done to fill gaps, how we're going to eliminate duplication or merge duplicated programs and services or build on each other so that we can build a plan that works for everyone. Okay, so how does this fit with the health enhancing environment? It contributes to that because we want to focus not only on individual factors, but we want to also focus on other factors that address the structural, interpersonal, social, cultural aspects of the campus and how they impact alcohol and drug misuse. And in order to do that, we have to be thinking about those aspects of the student experience and how they impact alcohol and drug misuse. So throughout the strategic planning process, I like to keep the social ecological model front and center. This is to make sure, so here's a picture of the social ecological model.
Mm-hmm.
And I use this to make sure we address the multiple domains of campus life that influence student behaviors and experience. The social ecological model comes in many forms, and I like to use this one. It's a model developed through NASPA's Leadership for a Healthy Campus initiative many years ago. If you Google it by name, you can obtain a copy of the guide for using this model. This version of the social ecological model considers characteristics of the individual, the physical setting or place. So in other words, it's hot here in Arizona. People like to swim and we like to make it look like we're all on vacation. So that might drive up drinking rates, that aspect of the physical setting. Characteristics of the people, the organization, and the social climate of the surrounding communities. So that includes the political climate. All of these influence student well-being and student success. The idea is to consider the various factors within the individual and within the environment that act as barriers or supports to student well-being and determine what actions we will take within the context of our plan to address each of these domains. The ultimate goal is to create a health enhancing environment that reduces risks relative to alcohol and other drug misuse, where students can thrive.
There's so much packed in there, Karen. That's so I want to just go off on a couple of them. But one of the things you talked about was a change process. And you also talked about the word plan. And so I put those together in an old body of literature called Plan Change. And I know we referenced that in the guide. Strategic planning, it sounds like what you're saying is you want to change something because that drug and alcohol misuse causes problems for the institution. I mean, you talked about the environment, so there's challenges there. You're not meeting some of the institutional goals that you articulated as part of the mission statement, whether it's being civic minded, being productive, post-graduation, being successful so you can graduate. So it's plan change to address a lot of the problems, the contributing factors.
Absolutely.
Does that capture what you said?
Absolutely. In a nutshell, you're good at that.
Well, the other thing, just to highlight, is the specific role of drugs and alcohol and drug and alcohol misuse in contributing negatively, I would posit, contributing negatively to a lot of those missions that individuals and the institution has. And so you talked about the strategic plan, and we're focusing here on strategic planning with respect to drug and alcohol efforts. Mm-hmm. But you talked about all these other strategic plans around the campus that feed into the larger mission for the institution. Did I hear that right?
Right. And I don't think we can really do strategic planning if we're not thinking of how we fit in the context of the institution, because that's where the work is going to be taking place. So, for example, one thing that I emphasize when we're doing our planning is the importance of staying current on the issues, right? What are the issues of greatest concern to our college presidents, the vice president, the provost, other offices across campus? What are the goals that we're looking at? What are the concerns that are, getting our focus right now? So, for example, the current focus that I'm aware of is student mental health and belonging. Well, when I think about those, I can't help but using my alcohol and drug library and using my knowledge and experience, I can't help but bring into the conversation how prevention and how alcohol and other drug misuse intersect with mental health and belonging. So when we're doing our plan, we can always keep prevention as a part of the contextual plan of the university, whether it's, whether the focus of well-being is on mental health, as it is currently, whether it's on other indicators like intimate partner violence or sexual violence. There are strong correlations between alcohol and drug misuse and almost every other behavioral problem that presents as a barrier to student success and influences the success of students across the community, whether they're using or not. So it's really important that we understand that intersection and how our work is playing a role in moving forward the work of the university and other offices on campus, and be able to articulate that so that when substance abuse isn't the top issue, it's still getting attention. It's still an issue that's relevant, and we're keeping it relevant through our plan, through how we talk about our plan, and through how we use the context of all of the interests, or as many as we can really capture in our plan, to be able to articulate that role and to be able to keep prevention as front and center as possible, because otherwise it just falls off it falls out of favor, I guess would be a way of saying it, where it's not as important as whatever's happening right now, but it's only not as important because someone hasn't connected the dots. And we need to be able to connect the dots when we're talking with people, and we need to be able to connect the dots in our plan.
Yeah, so there's two parts on that. Just to summarize that what you've just said. One is showing the relevance, showing how our participation, campus prevention specialists' participation in solution finding, how on alcohol and drugs can help with some of these other issues. That's what you're talking about. And then the other, stealing someone else's thunder from one of the other areas, in our model, you've just articulated communication and advocacy, that critical for the 8 competencies, one of them, and all of these linked together. And you've just said, okay, so let's go to the webinar on that one and see what that expert has to say. So
Absolutely.
yeah, so let's shift to another question. When we built this, when we built strategic planning, we ended up with 7. Now, the aim now is not to talk about all 7 of these. Our viewers can go to the guide at www.preventioncompetencies.org. They can go look it up and read those, read the 7, and read the various applications and the knowledge and skills that feed into each of these 7 applications. But what jumps out for you? Is there one or two? The answer, you can't say 7, but which of these is, what resonates the most for you? Or if there is 1 or 2 or 3 that really jumps out for Karen Moses? I know, tough question.
Well,
Sorry about that.
it's okay. Engaging stakeholders. Actually, there are probably 3 that jump out to me, but I'm gonna emphasize them because they connect in my mind. Okay, so engaging stakeholders, blending broad and focused approaches, and overseeing contextual elements. So we've talked a little bit about each of these, and I guess this is my opportunity to go into a little bit.
Please, some examples. Yeah, perfect.
Yeah. So for me, engaging stakeholders means bringing together the students whose behaviors and environments we're trying to change, along with faculty and staff who care about them, people in positions who interact with or have responsibility for some aspect of prevention work or the population that we're working with, those who do health enhancing work, or really any relevant role, might be the campus police or someone from outside of campus, whether it's the police or the distributors or whomever. It means bringing them together to discuss the needs, the risk factors, the protective factors in the environment, to discuss what the current map for prevention looks like. So it's a big job. Where are the gaps? We're looking also together for evidence-based programs and practices that could address the gaps, identifying innovations that are grounded in theory that you might include in your plan, developing together a plan based on the evidence that we've examined of what's needed, and also based on what has been shown or can be predicted to work. So we're not just throwing pasta on the wall and seeing if it will stick, right? We're planning something that has evidence, either through an evidence-based study, right? Or theoretically, it might work, or it could work, or it's likely to work.
You believe it, you have reason to believe from one of those.
And we can even build a logic model that shows how our whole plan, when we put all of the components together, aim towards our overarching goals, which are to reduce risk and to improve campus well-being, those kinds of things. So we're going to look to these individuals as our partners, not just as, like a few people we pulled together and, they're going to go away in a few days or months or whatever. No. We want them to be part of the work. We expect them to help with implementing the plan, to share resources. We expect for us to keep each other updated. We expect each other to take the time to monitor the metrics so that we can evaluate if the plan is moving us towards our goals. And what's interesting is that as I was thinking through what I value about the process of strategic planning and what I think is really important, I can't help but emphasize the importance of relationship building, right? Because in most cases, when you're putting together this group to create a prevention plan, these are not people who report to you. So when you coordinate involvement by multiple departments and groups to plan and implement a comprehensive campus program, the relationships you build are going to make a difference in your ability to make it happen. So it's helpful to start and nurture relationships even before you ask them to be a part of what you're doing, right? It's helpful to ask people who you know will contribute, who have responsibilities, resources, and a commitment to the cause of prevention. But it's also necessary to establish new relationships, because sometimes the persons that are added to your group are appointed by their director or their dean, right? So you have to build relationships with people who are new to you and sometimes who aren't effectively contributing, with the hope that the relationship you build will enhance their interest and their commitment to the process of planning, right? And the plan itself. And I'm just going to hold up a little informational piece about intentional relationships. These are described by the Leading Change Network as being grounded in shared values that they're meant to last beyond the current task that you're taking on. They're based in a shared commitment to specific goals and shared resources and time committed to reach goals together. And all of this requires that you nurture them and provide them with the attention that they need, because ultimately the social capital that you develop through relationships can leverage collaborative actions much broader than you imagine. And that is going to make your strategic plan that you all make together work most effectively. So relationships are key.
Let me just
strategic planning.
Yeah, let me just comment on relationship. Well, I'm hearing two different things, not competing, but I want to clarify and get your take on this. It's not just, if you will, you, the coordinator, and these individuals, some of whom you know, some of whom you brought in, some of whom were assigned to your group. But is it not also the group itself, the relationship with the 10 or 12 or 15 of them together? That sounded embedded in what you were saying.
Well, I guess for me, it goes without saying that you're building relationships, obviously, with the members of the group, because you want to know them, you want to know what drives them, you want to know what their values are. You want them to do a lot of the talking and giving, right? Giving information, etc. But at the same time, you obviously need a skill set for helping foster positive relationships across the group. And ultimately, I mean, this makes me really excited. I'm glad you brought it up. Ultimately, what we do can be so much bigger when we're all working together.
Yeah, the collaboration,
goals, right? So, we're collaborating on a plan, but the better we collaborate across the whole group together, the more open we will be to shared responsibilities. And, we can't do prevention just all on our own. And it's like, we know this. You don't want to have a group that comes together, builds the plan, and then says, you go do this.
Yeah, congratulations. Yeah, so that with that group synergy and those people coming from different walks of life and different expertise, that goes back to something you said a little bit ago about innovation.
Mhm.
And then it also dovetails to what you said at the beginning, and then you used the word a couple minutes ago about shared values.
Mhm.
And if we can anchor ourselves in that, that feeds so nicely into strategic planning.
Absolutely.
Yeah. So I just wanted to build on that relationship theme of yours. Anything else with those, your key elements within, again, within the,
Yeah.
okay, good.
Yeah, I can keep going.
Keep going. Keep going.
Yeah.
You're doing, this is great.
So another of the sub competencies is how I've been framing them is blending broad and focused approaches for me. This means integrating with the entire map, which we've talked about already.
Right.
Whether it's an individual focused program, a universal message, a change in policy or practice, or a training that you're doing, these are all meant to be integrated into your logic model or your map of prevention, and then monitored for their contribution to the metrics that you're aiming for. So the visual that the logic model presents then is helpful for showing how each initiative, program, policy, or other aspects of the plan contribute to the overall prevention plan, right? And as I mentioned, the map then provides an indication of how each element aims to contribute to the change in metrics. So your policy might be contributing in a slightly different way than the training that you're doing for faculty and staff, so that they understand the normative drinking behaviors better, for example. So all of these fit together to ultimately lead to the goal or the goals that you have set. Now, the other competency, I think, well, overseeing contextual elements, I think really is next, next in my thought process, because we see in this competency the responsibility of keeping the plan needs-based, current, and appropriate within the institutional context. And so this means that as we bring our stakeholders and our partners together, we have to help maintain their focus on the current needs among our students, which we should be arriving at from our needs assessments, right? So we provide leadership that maintains energy and excitement around evaluations that demonstrate that our stuff is working, and or that we need to tweak what we're doing. We need to tweak our plans or how we're implementing them in order to get better results. And then we move forward to do that tweaking, to strengthen those plans. We pay attention to diversity, equity, and inclusion. We build these factors together to provide the context for our plans and then for how we're going to evaluate them. So for me, this overseeing contextual elements kind of brings together the relationships, the blending the broad and focused approaches, and then making sure that through those relationships and that commitment and the plan that we've built together, that we're on board to oversee and move us as a large group of partners that are aiming towards these similar goals, these same goals, towards measuring that we're getting there, tweaking, and making sure that ultimately I guess the way I'm thinking of it is like you're steering the whole group towards the ultimate goals.
Right. Yeah. Yeah. Your ultimate vision, your ultimate
Yeah.
outcomes that you want. Yeah. Which goes back to health enhancing environment, which is
right.
how it feeds. Yeah. You've given a lot of examples. Are there any other examples or illustrations that might be helpful? The intent of this entire webinar series with these 8 different segments is to bring this written document to life. So is there anything else with strategic planning, or maybe saying it differently, what holds people back? Or what tips might, there's a lot folded into this, but anything else that might help, bring bring this document and the strategic planning part of this to life?
Right now, I'm kind of stuck on that thought of what holds people back.
Okay.
So I'm going to speak to that.
Good.
And then I also have thought about some cool examples that
Good.
I'd like
Good.
to share
Good. Love it.
about, bringing partners together to create strategic plans. Yeah, I think sometimes that strategic planning can seem tedious or boring even,
Yeah.
depending on how it's done, right? And if it's done in a tedious or boring way, then your partners, your team, even your own team, your own staff, they're going to be yawning. They're not going to want to do it. They're not going to be excited about the potential change. If it takes too long, I mean, there's some work that shows that the longer it takes for us to finish a plan, the less effort we put into it over time, because it gets tedious. So one thought is make sure that it doesn't last, that the strategic planning process doesn't take forever.
Right.
Get those needs assessments done, move forward. Don't wait until the plan is perfect. Have a working plan so that you can tweak it as you go along. You know what your goals are. You're moving towards that direction, but you're not embedding the plan in, or that's not the right words that I want to use. You're not waiting until the plan is perfect to get started. Instead, you're identifying the few key issues, the few key programs that you're going to get started, how you're going to measure them, and you're just moving forward so that people don't lose that excitement and energy around the plan. So I think that to me is one of the biggest challenges.
Yeah. Keeping them bought in, keeping that buy-in there.
Yeah. And, if it takes too long to get things started, honestly, the university president could change in the meantime, and then the whole plan falls apart. So instead of waiting until some other big change takes place, get things rolling so that you're already doing the prevention activities and you're already accomplishing your goals. And then as a new president comes in, you can show them what you've already done and earn their trust earlier in the process for the prevention work that you're doing.
Right. And that goes back early on. You talked about that overall mission and all these other units having their own strategic plans. If you do yours really, really well, maybe there's a lot of the processes that you're doing that others could adopt or adapt. Learn.
Absolutely.
Yeah. Good. You said you had some tips or some other examples or something you want. You're smiling.
I do.
Go for it. Do it.
So this maybe doesn't exactly flow from where we're at right now, so I apologize in advance for that. But here are some thoughts that I had. Bringing together prevention partners in a way that helps to coordinate involvement is really important. So coordinate involvement is one of the sub-competencies for strategic planning. And what we want to do is make sure that prevention efforts across the institution are working in concert together, not competing with or working against each other, right?
Yep.
So, I mean, that's part of the relationship forming, part of bringing people to the table, et cetera. So I have an example that that happened with the work that I was doing, or I am doing at ASU a while back. And this was a time when we were using a particular online education program, and a sales representative from another vendor started trying to bring their product onto campus by, they already knew that they had already talked to me. So they knew that we weren't going to go with their product. We'd already moved forward with another product. So they started approaching other departments. Well, the other departments were a part of our partnership group, right? Part of our work group. And they formed a united front for consistency of products used across campus, because we had made a decision together that instead of everyone buying their own product, from the Sun Devil Athletics to the fraternity sorority life to Res Life, etc., that we would all use the same products, and that we would be able to get a consistency in the messages that we were providing for students, and that we would be able to plan additional education based off of what we knew was in the education that was in the online platform that we were using. So what ended up happening was the salesperson kept getting referred back to me over and over again. And then I just had to have a sit down talk with this salesperson about, look, right now is not the time to keep pestering us. I probably didn't use that wording, but to keep approaching us about this product that you have to offer. If it's a good product, we may use it in the future, but right now we've already purchased this other product and we are going to all use it, all. So please stop, respect our decision. And I was only able to really get to that point because the whole group that we were doing strategic planning with, and that we were implementing the plan together with, was on board with the plan. So I think that coordinated involvement and making sure things fit together is really important.
That's a great example. It's very good.
I have another example.
Go for it. Then I have another question.
Okay. So I know that you're familiar with this story, David. For many years, we worked closely with the local beer distributors in a collaboration called Wholesalers Advocating Moderation. So we had Coors, Miller, and Budweiser reps as a part of WHAM, is what we called it. And by working together with them, they modified their advertising practices on campus so that they weren't advertising in the campus newspaper, they weren't promoting their products at events on campus, and they were also helping to influence how local venues in the surrounding area were promoting drinking and such. So the goal that we had within this collaboration was to reduce high risk and underage drinking. And the collaboration was, of course, part of our overarching strategic plan. And it required, of course, building relationships with the beverage industry while also defending the relationship and its role in prevention with other folks on campus who were skeptical of what we might accomplish with the beverage industry, right? So this involved coordinating involvement, right? As the campus newspaper didn't want to lose money on ads that they were getting money from the distributors for. So we worked with the distributors to have them pay for ads for social norms marketing. So they were still getting their money that they needed, and the distributors were still promoting their goodwill through these ads. And then we also kept a record, and this is a part of that strategic planning and coordinating the implementation of it. We kept record of the number of problematic ads that showed up in the campus press, not so much by the distributors, but by local bars and pubs. And we kept record of the content of the ads. We tracked the number of roads the distributors paved for us, not literally, but when we were working with local bars to create a safer environment for students, they paved the way. They knew those folks. They knew how to get in, they knew who to talk to. And then we demonstrated through our records the benefits of partnering with the distributors towards the overall goals that we set for our strategic plan. So it was all in all a very effective way to contribute to our strategic plan to work towards our goals.
So that sounds great, but I bet it wasn't quick.
Oh, no, not at all.
Just to be clear, I mean, you talk about this, and so just to be clear, you talk about relationships, and this is a longer term process for you.
A multi-year process. So absolutely. Because
so be patient is your
right. Be patient. develop those relationships, figure out what drives them. Why would they want students to drink less, right? Why would they want them to be safer?
Right.
Those kinds of things.
So,
It's your audience, right? You market up, or you manage up or manage across, right?
So as we're moving towards the end of this, stepping back, what's important for our audiences to know, whether it's about the strategic planning just specifically, or the entire document? What's important for them to know? And are there any specific messages, like you've mentioned different constituency groups? Is there something specific you want to say to student athletics or fraternity and sorority or student leadership, or some other campus high-level administration or trustees? Is there some other specific things? I know in this document, we have, how to use the guide and specific ways the different audiences can use it. But is there something that Dr. Karen Moses wants to say about the whole, or about strategic planning? I mean, it's kind of open on that.
Yeah, I do. I'm thinking. For right now, what I'd like to do is emphasize the importance of the needs assessment that establishes that starting place for strategic planning. And what I have observed, and I'm certain that the folks that are watching and listening in have also observed this, is that often programs are developed to address something someone's interested in. Like maybe they work in the conduct office or the counseling office and have a sort of a biased view of the drinking norms. So they may want to focus all the efforts in prevention on the needs of these high-risk individuals, not realizing that they represent a small portion of the student population. So having survey data analyzed by subpopulation or by department or college can assist your campus partners in understanding the breadth of the efforts that are needed to reduce risk. It's not just what you're seeing in your own work experience, but it's really how students are engaged and experiencing campus life in all of these different areas of campus. And then that it's also important to mix survey data with qualitative data. And what I mean by qualitative data is stories that students tell through interviews or focus groups, or when you're talking to them about a subject in the classroom or in your training groups, from feedback, from interviews with faculty and staff who work closely with students who may present a different perspective or a clarifying perspective on what is driving the data in the direction that's of concern to the strategic planning group. So one thing that's happened with us is that by talking to students who don't drink or don't drink much or often, I learned that they feel stigmatized because of their non-drinking choices. They feel like other students don't like them as much or want them to be at drinking parties as much, unless, of course, they play the role of the designated driver or the sober driver. They feel unsupported and unpopular. Now, this is generalizing to the whole group, and maybe the whole group doesn't feel this way, but it really begs the question, how do we offer non-drinking students ways to socialize where they feel welcome and wanted? And I was able to have a conversation during a training with a group of fraternities and sororities, and had them think about, even within their own membership, there are people who don't drink often, maybe choose not to drink because they're taking medications or because they have a test coming up that they want to prepare for, whatever, work tomorrow. And they feel out of place at their social events. So how do you plan a social event that includes them, that makes them feel welcome and a part. And then with, my planning wheels going, and then the more people who show up that don't drink, the more the non-drinking experience will be a part of the experience that students think about. And maybe they'll consider that as a choice because those people are having fun too. They're not outside of the group, they're inside the group. And that will make a difference, I think, ultimately in what people perceive as the norm and ultimately impact the norm. So
Yeah.
Those are the kinds of things that I think are really helpful to bring into this planning process, to think outside the box, to talk to students, to have them help clarify what the experiences that we're seeing in the data mean to them.
Yeah, and what I take from that is you're putting the strategic planning framework on promoting the health enhancing environment, not just for the institution as a whole, but for individuals. And through that process of as one of the other 8 areas, the needs assessment needs assessment and evaluation, you've used those words throughout these remarks this afternoon. Because that's you're keeping your finger on the pulse.
Right. And because strategic planning really can't be done well without having that needs assessment.
So as we wrap this up, any final thoughts that you'd like to share?
I think that the leadership that strategic planning provides the opportunity for it's such a great opportunity to engage people, to form relationships that can end up being some of your most wonderful partnerships and friendships even, which, dare I say, are so important in the workplace.
Right.
And that ultimately planning together with people who share values and commitments to prevention is uplifting, and that together we can make such a big difference, and that ultimately having a plan can help you keep your eyes on the goal and help everyone see how they fit. I just think it's so important, and I wouldn't I would ask anyone who is working in prevention to make sure that they have a plan and that they have partners that will help them build the plan and fulfill it.
So I really like that. And the way you said that, together we can make a difference. So there's a couple parts on that. So the together is part of the relationships. But the other part of together is, again, with this resource, we came up with some resources just on strategic planning. So it's not, you don't just have to read these 7 bullets in this publication, but look at the references that we used and that we refer our audiences to. So it's a lot of work, and you've done a great job today bringing this to life, giving some examples, offering different perspectives to help shape and help to motivate and to take some of the sting out of it for a lot of folks.
I hope so. I hope it's been beneficial, because it is certainly wonderful work. I couldn't have asked for a better career.
And that's a nice closing. And again, going back to your words, together we can make a difference. So thank you, Karen, for your very helpful insights and your comments. You've really helped to bring this competency area to life. And of the 7 specific competencies, the resources, you've really helped shine a light on this area. And we know it's aspirational. This is the ideal. This is what we seek. And we're constantly evolving and constantly trying to get better. So in closing, I want to thank the initial funder of this publication and our work with these 5 experts from around the country, the Mid-America PTTC. Rich mentioned that in the opening remarks, the Prevention Technology Transfer Center, Mid-America PTTC for their initial funding for this. I thank Rich Lucy and his colleagues at the DEA for their sponsorship of this webinar series and for all of their good work. And now the work and actually the opportunity, and Karen, in your words, to make a difference, it's up to the audience to move these forward, to move forward the competencies, not just as a concept, but as a reality. Because by doing that, it really helps our college campuses and ultimately our students as they move forward and grow in their lives. Thank you for engaging with this. Go to www.preventioncompetencies.org and the DEA Campus Drug Prevention website. Lots of resources for all of us as we help to move forward. And again, Karen, in your words, helping to make a difference. What a great career. So thank you. Thank you again, Karen.
You're welcome. Thank you for inviting me. I'm happy to be a part of this.
Yeah, thanks.